Good afternoon. My name is Kristen Jennings. This is for the medication administration record assignment for administrating oral and intramuscular medications. The importance of the rights of medication include the right person, the right dose, the right time, the right route, the right medication, as well as the correct documentation. I have my MAR in front of me, and the patient we'll be working on today is Miss Millie Larson. Her date of birth is 01/01/1936, and she has no known allergies. She is due Practi-Docusate 100 milligrams tabs orally right now, so at 4 p.m. And she's also due the Practi-Haloperidol 2 milligrams intramuscular at 4 p.m. So I'm going to go ahead and perform hand hygiene. And I'm going to go ahead and gather my supplies. So right now, I have my pill cup. I have my cup of water. For the intramuscular injection, I have the 23 gauge needle that will be needed for this injection. I also have the 3 milliliter oral solution for Millie. And I do have a Band-Aid, and as well as my clean gloves. So I'm going to go ahead and take a look at the medications that I do have. So right now, Millie is due the Practi-Docusate 100 milligrams tab orally. So I do have the Practi-Docusate sodium. The expiration date is 03/24, 50 milligram tabs. So she is due 100 milligrams of the Docusate tabs. There's only one in here. For training purposes, we're going to pretend we have two. So she would receive 2 tabs of the Practi-Docusate sodium. And again, that's for Millie Larson, date of birth 01/01/1936, and she has no known allergies. Our next medication we're going to take a look at is the Practi-Haloperidol. Again, for Millie Larson, date of birth 01/01/1936, and she has no known allergies. The vial states Practi-Haloperidol, and the amount is 5 milligrams per milliliter, and her dose for the Practi-Haloperidol is 2 milligrams. So with our calculations, since this is a 5 milligram per milliliter vial, our calculation she'll be receiving 0.4 milliliters of the haloperidol. So what I'm going to go ahead and do next is I'm going to prepare the oral injection for her. So I'm going to go ahead and sanitize my hands again. I'm also going to put on some clean gloves as well. I can get the gloves on. There we go. I'm going to remove this little blue tab here. I do not have any alcohol wipes, but for safety reasons, we're going to pretend that I did that. So we're just going to wipe the top over here. I'm going to open up my needle. Get my syringe ready. Pop that on there. And we're going to inject 0.4 milliliters of air into this. I'm going to pop that off. There we go. There. Push in the air. And then I'm going to get 0.4 milliliters out. Go. Down. Carefully put that on there. I also have a piece of tape that I'm going to put on here that has the amount of the 0.4 milliliters so that I know that is what's going to be used. And I'm going to go ahead and dispose of that in my sharps container. Some may allow you to keep it. We're going to dispose of that today. Okay, so I'm going to go ahead and get rid of my gloves. Bring another pair with me into the room. And then I'm going to go ahead and sanitize my hands. Gather my supplies on this clean tray that I have. I'm going to knock on Millie's door. Knock, knock, knock. Good morning or good afternoon. My name is Kristen. I'm going to be your nurse today. I'm here to give you your 4 p.m. medications. Can I have your name and date of birth? She'll tell me her name is Millie Larson, date of birth 01/01/1936. I will go ahead and check her ID bracelet. It does verify Millie Larson 01/01/1936. I will then go ahead and ask Millie if she has any known allergies, and she states she does not have any allergies. Before I do any of this, I can't remember if I did say it or not, but we want to make sure we do provide privacy. So I will go ahead and close the door as well before asking any of these questions. So I'm going to go ahead and take a look at my medications that I have against the MAR. So right here, we're going to start with the oral ones. So I do have the Practi and Docusate. It does have Millie Larson. I do have Millie Larson. Date of birth 01/01/1936. Practi Docusate, 100 milligrams tab orally. And Millie, we're giving you this medication, the Docusate. This is going to help soften your stools. So I'm giving her 2 tabs. There's only one here, but remember, 50 milligrams, we got 2 tabs. So 2 tabs, putting that in here. I'm going to open these up, give to Millie, and here's her water. I'm just going to assess Millie to make sure that she is able to swallow those properly. She was able to swallow them. So the next step, what we're going to go ahead and do is next, Millie, I'm going to give you your Practi haloperidol. So the haloperidol, let's see, on my syringe here, I put 0.4 milliliters. She is, again, Millie Larson, 01/01/1936. The Practi haloperidol, we do have the haloperidol, 2 milligrams or 0.4 milliliters. And Millie, I'm going to need you, I'm going to help you go ahead and lay on your left side. So I'm going to go ahead and sanitize my hands again. And I'm going to go ahead, don clean gloves. And then I'm going to assist Millie with laying on her left side since I am right-handed. So Millie, what we're going to go ahead and do is give you this intramuscular injection of the haloperidol. This is going to help with your little agitation. I'm hearing you're a little agitated, so this will help kind of relax you and get you more comfortable. So again, we're going to get her on her left hip. So what we're going to do is we want to locate the greater trochanter on her left hip. So again, we're going to clean with an alcohol prep, which I don't have, but for all purposes, we're going to clean with alcohol prep. So I do have my orange here. So with the alcohol wipes, we're going to start from the center outward. So center and then outward, just cleaning. And then we're going to make sure that we're going to allow it to dry. So give it a few seconds because you definitely don't want to give poor Millie an injection with alcohol when it's wet. So I'm going to choose my non-dominant hand. Since again, I am right-handed, I'm going to take my non-dominant hand and we're going to hold it taut, kind of like a triangle, just taut, right like there. And then I'm going to go ahead with my dominant hand. I'm going to go ahead and insert this needle, if it'll let me. There we go. I'm going to insert the needle, and again, we have 0.4 milliliters of the haloperidol, and I'm going to go ahead and inject this on a 90-degree angle. And I'm going to go ahead and insert the needle. There we go. The 0.4 milliliters. I'm going to go ahead and slowly take it out. Throw that in my sharps container. And then what I'm going to go ahead and do is I'm going to go ahead and dispose of that, which I did. I'm going to remove my gloves, perform hand hygiene, sanitize my hands, and then I'm going to go ahead and just document what I had done to Millie. So I'm going to document that I did put the intramuscular injection, the 0.4 milliliters of haloperidol, on her left hip. I'm also just going to stay in the room for a few moments just to assess Millie if she has any other questions or concerns. I'm going to go ahead and just lay her back right on her back so she's comfortable. Make sure that the bed is locked and then close the door. And again, I did document on my MAR that the time that was given was 4 p.m. for both medications. And she was given the intramuscular 0.4 milliliters of the haloperidol on her left hip and tolerated. This is all that I have for today. Thank you so much. Have a good day.